Good morning, and welcome to this presentation on our evidence-based population improvement project focused on healthcare access in the Navajo Nation. The data reported in this presentation is highly reliable as it was derived from the 2023 Community Health Needs Assessment from a stratified random sample survey, as well as data and benchmarks collected from Vital Statistics, the U.S. Census Bureau, Healthy People 2030, the Centers for Disease Control and Prevention, the U.S. Department of Health and Human Services, and the 2023 PRC National Health Survey. These sources were accessed through the San Juan Regional Medical Center intranet page, as well as Summon database. References are listed in the bottom right corner. We'll start by addressing the background of the clinical problem. According to the 2023 San Juan County Community Needs Assessment, having a specific source of ongoing care was identified as a disparity in the rural secondary service areas. In these areas, only 30.6% of patients reported a source of care. These secondary service areas encompass portions of the Navajo Nation and surrounding areas and represent healthcare disparities within the Indigenous American Indian community, which represent nearly 40% of the population, according to the U.S. Census Bureau. This data is also supported by current evidence from the Agency for Healthcare Research and Quality, which demonstrates that ethnic and racial minorities continue to experience poorer outcomes due to persistent healthcare disparities. This has been attributed to poor communication, bias, and impaired health literacy. In addition, these groups are negatively affected by access to healthcare, decreased healthcare quality, ineffective treatment, decreased safety, delays in care, and a lack of preventative care. The PCOT question being addressed is, would members of the Navajo Nation experience improved engagement and healthcare access through the utilization of telehealth applications over the next 3 years as compared to the current state of non-utilization of digital access? The key stakeholders for our project are Navajo Nation residents, community physicians, and community healthcare providers. In addition, the Navajo Nation utilizes a group of trained community health representatives to partner with the Community Outreach and Patient Empowerment, or COPE group, to improve patient engagement, compliance, and outcomes utilizing the improvement methodologies listed in our action plan. We would like to establish a partnership with these community groups to promote access and participant buy-in, as they have already established rapport within the Navajo community and are already utilizing established culturally and linguistically appropriate resources. A lack of health literacy is perceived as a barrier among Indigenous populations, but is necessary to facilitate effective communication and help patients understand health information. This may contribute to misunderstandings between Indigenous peoples and healthcare personnel who assume that a lack of health literacy is attributed to a lack of care or engagement. Health literacy enables patients to obtain, comprehend, process, and communicate healthcare information and make well-informed healthcare decisions. To address this inequity, the two-eyed seeing approach can be applied to establish cultural priorities, potential barriers, and infrastructure needs. The United Nations has declared internet access to be a human right, yet the limitation of the application of this technology is that an existing digital infrastructure is needed. This must be accomplished in conjunction with tribal leaders to mitigate risks associated with access to care, improve access to providers and healthcare information, and mitigate adverse outcomes due to a lack of healthcare access. When considering the use of a digital infrastructure for communication, it is also important to assess digital literacy in preventing misinformation, breaches of privacy, and security. These are all important issues to consider in fostering sustainable engagement that is ethical, safe, and culturally relevant. Linguistic isolation is another barrier experienced by the target population. Language discordance not only impairs communication, but directly contributes to low health literacy and negative outcomes. Negative outcomes can be attributed to inaccurate diagnoses, poor follow-up, a lack of treatment compliance, complications from medications, redundant diagnostic testing, and lengthened hospitalization. Many of the current social, socioeconomic, and health disparities among Indigenous peoples can be traced to the long-lasting effects of colonization, assimilation, and lack of access to residential schools and healthcare. To bridge this gap, our action plan must be community-driven and patient-centered, with a goal of implementation within the next 6 months. When working with Indigenous populations, a two-eyed seeing approach fosters engagement by incorporating Indigenous knowledge and culturally significant practice with Western knowledge and technology. Specific improvement criteria include providing resources in the patient's primary language, including translators who are trained to translate medical terminology, and incorporating cultural holistic treatment options. In rural care areas such as the Navajo Nation, the application of smartphones may present a modality for facilitating communication and sharing information. The utilization of smartphones within indigenous communities in North America has already been shown to greatly improve communication speed and is the primary means of accessing the internet. Providing patients with online resources, patient-friendly search engines, online classes, and in-person digital navigation courses are also effective ways to promote digital literacy, assisting them in navigating digital resources and telehealth applications. In addition to assuring that technologies are culturally appropriate, it is important to address potential linguistic barriers to success. Fortunately, expansion in telehealth also presents another innovative modality in the form of video interpretation. The outcome for this population would be to improve access to healthcare providers from the current rate of 30.6 to the Healthy People 2030 benchmark of 84%. This could be measured by readministering the portion of the Community Health Needs Survey regarding access in 1 year and 2 years, and comparing data with the full Community Health Needs Survey planned in 2027. To achieve the quadruple aim of improving the patient experience, it is important to consider the interoperability of digital telehealth technologies with video interpretation services. Pairing telehealth visits with professional medical interpreters facilitates communication of complex medical concepts and terms and allows the patient to ask questions to obtain clarity. This not only facilitates patient engagement and health literacy, but the ethical principle of autonomy supported by equitable and informed decision-making. As an evidence-based practice, healthcare institutions must facilitate access to professional medical interpretation services in order to provide ethical and culturally relevant care. Regarding the aim focused on population health, digital access to reliable healthcare information and providers mitigates current barriers to care associated with long wait times to see a provider, difficulty with transport, and limited availability of specialists within the service area. This access also supports the quadruple aim of reducing healthcare costs, as many of these patients are seeking primary care in acute care facilities or are being treated for preventable outcomes in acute care settings such as emergency departments and local hospitals. Regarding provider experiences, application of digital technologies has been shown to decrease frustration and increase provider satisfaction with their work, as providers feel that they are able to better connect and communicate with their patients. Thank you so much for your time today. At this time, I'll answer any questions that you may have. Again, references are in the bottom right corner.